Hi all, I'm Dr. Sharanya, Associate Professor of Microbiology and Infection Control Officer, Sree Balaji Medical College and Hospital. Today I'll be talking on infection control in healthcare settings. It comes under the competency number of 8.5 to 8.7. The specific learning objectives that I'm going to cover today are what are the major types of HI and its prevention, and biomedical waste segregation, prevention of needle stick injury, and spill management. The major healthcare associated infections are nothing but infections acquired in hospital by a patient admitted for a reason other than infection. So infection should not be present in the patient while admission, or the patient should not be incubating the infection at the time of admission. So symptoms should appear only after 48 hours of admission. So these categorizes the hospital acquired infections. So if you see the burden of the HIs, it's about 10% of the patients in developing countries. So they acquire at least one healthcare associated infection while they are hospital admissions. And the mortality is around 10% among the affected. So if you see the various factors which influence the healthcare associated infections, there are three major factors which play an important role. So they interplay among each other. First is the host. The host is nothing but the patient's risk factors, which usually include immunocompromised state of the patient, and the microbes. So if you see the microbial factors, they are nothing but multi-drug resistance, ability to survive in adverse conditions, and resistance to disinfectants. So all these properties of the microbes may contribute to the host in getting a hospital acquired infection. So the next is the environmental factors, which are nothing but if the environment is unclean, or if you're using unsterile instruments, or if the healthcare personnel is doing a procedure without the proper aseptic precautions to be followed, and if there is improper biomedical waste disposal. So all these environmental factors may contribute to the host's risk of getting a healthcare associated infection. So the major healthcare associated infections are usually coming under device associated infections, which starts with COTI. So if you say COTI, it's nothing but catheter associated urinary tract infection. So if you see the presence of significant bacteriuria in a catheterized patient with or without symptoms or signs in the urinary tract. So they may be symptomatic or asymptomatic, usually after 48 hours of insertion of a catheter. So these categories come under COTI. And the next major device associated infection is CLABSI. So CLABSI is nothing but central line associated bloodstream infection. So the common etiological agents include cons, Staphylococcus aureus, and the escape pathogens. So complications may include infective endocarditis in case of a CLABSI. So CLABSI is usually a surveillance definition. CRBSI is a clinical definition. So the next one is hospital acquired pneumonia or ventilator associated pneumonia. So if you see hospital acquired pneumonia, any pneumonia or lower respiratory infection which clinically occurs after 48 hours of hospitalization without intubating comes under hospital acquired pneumonia. Whereas if it's a ventilator associated pneumonia, so pneumonia occurs after 48 to 72 hours of endotracheal intubation comes under ventilator associated pneumonia. And if you see the next category, which is nothing but surgical site infection. So infections that develop within 30 days of surgery at the surgical site, or in case of surgeries like breast, cardiac surgeries, joint surgeries, which include implants, even 90 days consideration is there. So infection after a surgery over a time period of 30 to 90 days are categorized as surgical site infections. So these are the four device associated infections which are mainly contributing to healthcare associated infections. So if you see in this table, we have mentioned the various types of healthcare associated infection and the risk factors associated with it. If you see in case of CRBSA or CLABSI, central line insertion, the site even matters. If we are putting a femoral, central line, the proximity of femoral line to perineum is more, which leads to infection more. So central lines of femoral are more prone for a CRBSA or CLABSI than jugular. And if the patient is immunocompromised, or if the patient is getting TPN, and in case of an end stage renal disease, all these risk factors would ultimately lead to a CLABSI. And we saw the common organisms already, which includes escape pathogens such as E. coli, Staphylococcus aureus, top causing MRSA, and Klebsiella, Acinetobacter, Pseudomonas, and Enterobacter. Other organisms like Enterococcus and Candida could also be a contributing factor. And how to prevent? So usually the method of preventing these device associated conditions are called as bundle care. And CLABSI bundle includes proper separation of the insertion site and appropriate aseptic precautions to be followed by insertion of the IV lines. And after insertion also, the care of IV lines should be maintained. So these all comes under bundle care. And next topic is VAP, which is ventilator associated pneumonia. So here if you see the organisms causing the top organisms are Acinetobacter, Pseudomonas, and Klebsiella. And here the bundle care includes appropriate ventilator care and respiratory physiotherapy. And in case of CORTI, the common organisms are nothing but E. coli, Protease, and Enterococcus. And prevention usually includes catheter care and usage and selection of appropriate catheters for the patient. In case of surgical site infections, prolonged surgery and surgical drains are the leading risk factors. And the common organisms are MRSA and E. coli. And the method of prevention usually starts with surgical prophylaxis being administered during surgery appropriately, and proper wound care dressing should be done. And other than these, post-antibiotic diarrhea can also be a hospital or healthcare associated infection. This mainly occurs due to prolonged antibiotic therapy, and the organism usually involved is Clostridium difficile. And how to prevent this is you give appropriate antibiotic therapy for a particular duration only. Do not prolong the therapy, and supplement the antibiotic along with the probiotic to avoid diarrhea. So other healthcare associated infections other than the topics we discussed are needle stick and sharp injuries, which are occupational hazards too. So we'll see about this in detail in the coming slides. So how to prevent a healthcare associated infection? So in general, these are the 5 precautions which have to be followed by all healthcare professionals in a hospital setting to avoid healthcare associated infection. The number one causative or number one preventive strategy is following appropriate hand hygiene. So second one is usage of appropriate personal protective equipments. And third one is safe injection practices. And fourth one is safe handling of potentially contaminated equipments, surfaces which are in the patient environment. And the fifth one includes respiratory hygiene or cough etiquette. First, we'll start with hand hygiene. So hand hygiene is nothing but hand wash or hand rub, so which is very imminent when you deal with the patient. So hand wash and hand rub are nothing but the steps are same. The product used and the timing only differs. So usually for a hand wash we use a soap and water, which is sufficient. The timing should be around 40 to 60 seconds. And in case of a hand rub, usually we use a alcohol based product, which is nothing but a sanitizer. and the timing is usually 20 to 30 seconds here. So what are the various steps of hand hygiene? If you see, there are 6 steps which are given in CDC as well as WHO guideline. So first step includes palm to palm, and the second step is back of the palm to in both sides, and third step includes interlacing, fourth step is interlocking both sides, and then fifth step includes thumb rotation of both sides, and sixth step is scrubbing of your nails over the palms, so both hands. So these are the 6 steps which we have to do for an appropriate hand wash. So the timing depending upon the product used. So other than this, there are few WHO moments which also needs to be followed. So those are 5 moments given by WHO. So whenever you enter a patient's zone, so before touching the patient, you have to go in for a hand sanitization. It may be hand rub or hand wash depending upon what you're going to do. Second step is nothing but, second is before any aseptic procedure. So if you're going to put an IV line, or if you're going to put a catheter, whatever it is, if you're going to do an aseptic procedure, you have to go in for a hand wash or hand rub appropriately. And then next, third moment is nothing but after the procedure, or if you have undergone a body fluid exposure risk, then you have to go in for a hand wash or hand wash usually should be done. And fourth moment is after touching a patient. So if you are going to touch a patient, then you have to go in for a hand wash immediately. And the fifth one is, even if you have not touched the patient, you have just gone into the patient, inquired how he is, and if you have just touched the case sheet, that is the environment, then also you have to go in for a hand sanitization. So these are the 5 moments of hand hygiene which should be followed by all healthcare professionals in a healthcare setting to avoid healthcare associated infections. Next is personal protective equipments. Everybody should wear personal protective equipments depending upon the precaution that you want to follow. So personal protective equipments are nothing but wearable equipments which are intended to protect healthcare workers from exposure to or contact with any infectious agent. So example usually include glove, gown, face mask, respirators, goggles and face shields, etc. So all these you must know when to don, when to doff, appropriately how it should be done. So in recent pandemic times, we have faced lots of trouble which include donning and doffing of all these personal protective equipments. So I hope you all would be thorough with that. So next important thing is safe injection practice, which every doctor will encounter in their daily life. So usage of needles is however eminent, they should not be recapped. So if once you start recapping, what happens? You may prone yourself to needle stick injury. So once you use a needle, definitely go in for a needle cutter, cut the needle hub and then discard the syringe alone in appropriately. In usually plastic wastes are discarded, infectious plastic wastes are discarded under red bins. So you have to follow it like that. So common pathogens which are transmitted by needle stick injury are the blood-borne viruses. So the 3 blood-borne viruses which are hepatitis B virus, hepatitis C virus and HIV. So these are the 3. Among the 3, the risk is more for HCV and comparatively it is less for hepatitis B and then HIV. In the event of a needle stick or sharp injury, immediately what you have to do is report to the infection control nurse and then the HIC officer. So if the patient is known to be a HIV positive patient, or if you don't know the status of the patient, then you have to start immediately the post-exposure prophylaxis within 72 hours of needle stick injury. And this is usually according to the NACO, CDC and WHO guidelines. And next, if you see, if the patient is hepatitis B positive, if the healthcare workers is vaccinated, then you don't have to go in for any treatment. But if the healthcare worker is not vaccinated, then you have to go in for hepatitis B immunoglobulin and as well as vaccine booster dose and or initiation of the dose. So next is the hepatitis C. If the patient is hepatitis C positive, then there is actually no post-exposure prophylaxis actually given right now. So you have to wait for around the test to become positive in the healthcare worker. And if the healthcare worker becomes positive for either HCV RNA or antibodies, then only you will go in for the treatment. So as I said earlier, so this is a table showing the same status of the risk of transmission from hepatitis C, B and HIV. So as I told earlier, it is highest for around 1.8% for HCV and 0.3% for HIV, and around hepatitis B virus, it's 6 to 30% without any post-exposure prophylaxis. And steps: if once you get a needle stick injury, immediately what you have to do is wash the area, but do not squeeze or anything. Determine the patient's infection status, and if unknown, you have to go and start with post-exposure prophylaxis. And in case of hepatitis C, there is no PEP also. So if the source is negative for all three viruses, then only you have to go in for local cleaning, and probably you can get a TT. No PEP is required. So this is about needle stick injury, and always prevention is better than cure. So never recap the needles, and definitely go in for a needle cutter and cut the needle and discard it appropriately in a white container. So next important step is environmental cleaning. So in case of environmental cleaning, removal of visible soil and organic contamination from a device or environmental surface is very important. So disinfection is a less lethal process of microbial inactivation rather than sterilization. So medical equipments, whether they are, you have to determine whether they are single use or reusable. If it's disposable, you have to discard it after the single use device. And if it's reusable, you can use it again, such as surgical instruments, endoscopes, blood glucometers and other point of care devices need to be cleaned and reprocessed appropriately before being used on another patient. So this should also be maintained properly to avoid healthcare associated infection. So the fifth one is nothing but the respiratory etiquette or hygiene. So here what happens in all healthcare personnel or those who are coming in a hospital, they should be knowing this cough etiquette. So once you get a cough or sneeze, definitely carry around a tissue with you. So cover your mouth and nose with the tissue. Do not use your plain hands nor your shirts, whatever, aprons, whatever. You definitely don't use any of those. Only use a tissue or a kerchief. Cover your mouth and nose with it, and then once you have sneezed or coughed it, immediately discard it. So appropriate thing would be a tissue, not even a kerchief. So and then immediately you have to do a hand wash. So before the next. So if you carry around the same kerchief even in your hand, what happens? The organism is going to be present in the kerchief, which will ultimately be present in your hand, and you will be transmitting the infection. So respiratory etiquette is very important while you are handling high-risk immunocompromised patients. So definitely it's one of the key factors to prevent healthcare-associated infection. So next, how to discard biomedical waste appropriately. So biomedical wastes are generated in all hospitals, and you have to properly color code it and use non-chlorinated bags for infectious and non-infectious as well as general waste separately. So you have to use appropriate puncture-proof containers for sharps and needles, and a pre-treatment autoclaving of infectious waste such as blood and body products prior to disposal is very important, and deep burial and incineration of appropriate hospital waste in a central facility should be arranged by all hospital settings. So as I told, they have given a color coding for each type of waste material. So if you see, usually infectious non-plastic waste will go under yellow bin, and infectious plastic waste will go under red bin. So this white translucent bin, if you see, it's mainly for needles. Along with that, you can use waste sharp metals also. And blue cardboard box, which is also puncture proof container. So here you usually go in for broken glasswares, vials, ampules which you are using. So all those things such as cytotoxic wastes, metallic implants, all those will come under this blue box. So the final discarding from this, you have to appropriately pre-treat it, and then you have to such as autoclaving or microwaving has to be done at the source site itself, and then they are stored and then given to the third party for final discarding such as incineration or deep burial depending upon the category. So spill management. So the next topic. So this is very important topic which you will also encounter in your daily hospital. So here what you have to do, if you have encounter a blood or body fluid spill, so what you have to do? So immediately what you have to do, you have to isolate the situation and send all healthcare personnel outside, and then place a caution board there first. And then what you do is you take the spill kit, which will usually be stored in each department or each room. So based on the spill kit, there will be an absorbent material provided. It could be either sand or tissue, whatever is given, the absorbent material, take and put it over the spill. Immediately cover the spill with the absorbent material. And then the disinfectant will also be given, which is nothing but sodium hypochlorite. So you use the sodium hypochlorite. So usually if the spill is less than 10 centimeter, we call it as a small spill. So then this should be decontaminated with 1% sodium hypochlorite. And then you can give a contact time of 5 to 10 minutes. And then you can dispose. Otherwise, if it's a large spill that is more than 10 centimeter, then you have to go in for a 10% sodium hypochlorite solution and leave it for 5 minutes. If it's not available, you can even go in for 1% sodium hypochlorite, but you increase the contact time for it to work, such as 15 to 20 minutes. So then once the timing is over, then you clean up the spill. So usually while cleaning up, usually the spill kit would contain a forceps. So using the forceps, what you do is you pick out the broken glass materials first, and then put it in your collection tray which is given, and then you discard it. Usually, where will you discard the broken glasses? Usually they are discarded in the blue bin. So then you collect the other infectious materials in the tray, and then you can discard them. Usually they will be non-plastic, so you can go on for a yellow discarding. So this is how you have to follow it. And then once all this is done, you have to ask the biomedical, housekeeping person to clean the entire room using a appropriate disinfectant. So other than these, what are the other activities which are done by a hospital infection control team? So if you see, the surveillance of various healthcare associated infections usually will be recorded day-to-day basis by healthcare or the HIC team. And then if there are some healthcare associated infection, how to do an intervention, the suggestions will be put out by them. And preventive strategies, so how to prevent these healthcare associated infection will also be analyzed, presented in the meetings, and strategies will be developed based on that. So the monthly HIC review meeting should be conducted by the HIC team and infection control team. And finally, the outbreak management. So recent pandemics would have suggested that few maybe other outbreaks could also be waiting for us in the future. So such outbreaks or small outbreaks such as an MRSA outbreak or TB, MDR TB outbreak within the hospital could also be managed by the HIC team and controlled and intervened by them. So these are all the various activities done by the HIC team, and which also plays a key role in preventing healthcare associated infections. So thank you for patient listening. In conclusion, we have covered the major healthcare associated infections and how to prevent them, and how to segregate as well as discard various biomedical wastes, and the final treatment procedures, and how to prevent needle stick injury, the major cause for healthcare associated infection, and how to manage a spill, which is mostly blood spill. So these are the regular things which you will be facing in your day-to-day life in a hospital setting. So I hope with this class you are benefited, and you'll be able to manage all this. Thank you.